Hi, I'm Khaled from UPrest. Today with my colleague Victor Esno, we will highlight a review discussing the rationale of the MELODY study.
Hi, my name is Victor, and a few details about the background of the study. It was initiated following a review published in the Cancers Journal in 2023, which highlighted the gaps and the need for comprehensive evaluation for the localization techniques for non-palpable breast lesions.
So, surgical excision of the non-palpable breast lesion, as we know, it requires some form of breast localization. The major units use the wire-guided localization techniques, but also we have some alternatives like the radioactive seeds and the intraoperative ultrasound. UPrest and the IPRANET have initiated the MELODY study to study all these techniques. It's a multinational prospective intergroup cohort that will try to close the gap in this topic.
Regarding techniques, wire-guided localization is considered the golden standard of the techniques, but it comes with drawbacks. The need for interventional ultrasonographic or mammographic procedure prior to the surgery. Also, a notable 15% of reintervention rate due to incomplete tumor removal, and of course with patient discomfort and distress. Thus, other known alternative methods are being used, such as the radioactive localization, which is a wire-free approach that uses a gamma probe to detect pre-inserted markers. It is also used for marking the axillary lymph nodes with radioactive seeds. The disadvantages of this method is that in some countries it is still not authorized to use it. It is a complex radiation safety procedures, and also if it is needed, the reposition of the marker in this situation is not possible.
Another technique is the roll, using the technetium to label the lesion under sonographic guidance. It's MRI compatible and it showed surgeon satisfaction rate which is high, but still we have also the scheduling issues and also issues about the radiation safety. And here appear the magnetic and the paramagnetic localization techniques. It's wire-free, radiation-free also. It can be implanted many days before the surgery, but we still have concerns about the cost. May be not suitable for lesions visible only upon the MRI. Another modern technique is the Saviscot, which is a zero radiation breast localization system. It's a micro-impulse radar technology. Still we have concerns about the cost.
The RFID localizer, it is a small frequency, radio frequency tag, which can be identified by a small portable device. It is accurate and easy to use, but there are concerns regarding its use in patients that have implanted pacemakers or defibrillators. Intraoperative ultrasound is a very accurate and cost-effective method for localizing breast lesions. It needs no preoperative localization, but it's dependent on the surgeon knowledge and training, which is not easy to learn for the breast tissue. Of course, there is a need for an ultrasound machine available in the theater during surgery, which can represent a high initial investment for the hospital. And there also exists the carbon suspension. It is a sterile suspension of carbon powder used for stereotactic localization of occult breast lesions. Its disadvantages consist in that the marker cannot be localized via imaging. It is possible only through surgical exploration. So, the MELODY study targets to enroll around 7,400 patients that are diagnosed with either invasive breast cancer or in situ ductal carcinoma, confirmed by minimally invasive biopsies, and that are scheduled to receive breast-conserving surgery. The use of neoadjuvant chemotherapy or preoperative endocrine therapy are allowed, and the localization techniques, the procedures, and the treatment modalities are not restricted by the study, and they are decided by the treating physician. The patients are followed for 30 days postoperatively for potential complications.
Our primary endpoints will be the successful lesion or marker removal and the negative resection margins. If we talk about a home message from this article, we will say that the wire-guided techniques represent the gold standard for the localization. Intraoperative ultrasound and probe-guided technologies provide new option. The carbon localization is a cost-effective option used in some countries. MELODY aims to close the knowledge gap by comparing the available localization techniques. And the study is still open for participation, and for new centers willing to join us, you can contact us at melody@euprest.com. Thank you.